This is a video based on physio style screening methods. In this you should get an idea of what you're at physically. If there's any pain, just stop. The first video is shoulder flexion. Stand nice and tall, bring the hands to the back of the head, try not to overarch the back. If you're struggling, just brace against a firm surface. Back's in contact, thumbs go up, nice and tall, don't shrug the shoulders. Next video is shoulder abduction. Again, use that firm surface to brace against, get the hands in front of the chest and bring them out to the side as wide as you can. Try and get the palms to the back. Don't compensate at the hips by swinging forward, don't move the shoulders up and relax. Shoulder internal and external rotation, again brace against a wall, get the back of the elbows in contact. Try and swing the palms up to the top, but don't shrug the shoulders or drop the elbows. This one is Gerber's lift-off test for shoulder health. Look ahead, stand tall, put the palm of the hand against the back and just try and lift off. Any pain means there's something wrong in that shoulder joint and might need some further investigation. Apley scratch test, a dynamic test. Look ahead, stand tall, just try and put the hands to the middle of the back. What you might notice is your stronger side is more restricted. So don't inch the hands forward, just place them where you can and measure the gaps. Tennis elbow and golfer's elbow is all about the middle finger. Just apply pressure through. With the palm up, it's on the lateral side. With the palm up, it's lateral side. Palm down is inside the medial side. Prone cobra for the back. Just seeing what range you've got in extension. Lie down, get flat, get the hands under the shoulders and push up. If there's any pain in the lower back, just stop the test or don't go into the pain, just check the range every time. Half wall kneeling rotation, so we're going to get a bit of rotation through the trunk. Stand against the wall, brace that hand in, swing and control, just check the range. Be nice and measured as you move through. If there's any pain again, just stop. And of course we have to do both sides. Get yourself set up, jam the hand in, look ahead and swing through the trunk. So Faber's test, this just stands for flexion, abduction and external rotation. This is a test designed to assess the integrity of the hip. Get the foot, bring it across, apply some direct overpressure with the hand. If there's any pain in the groin, you'll know. With that overpressure as well, there might be pain in the sacroiliac joint, so that would indicate that there was something wrong and therefore again further investigation. And we do both sides. You might have one side tighter than the other. That's important. It's very important that we try and do both sides as well. So there's the overpressure, just checking, just finding out if there's anything wrong in there. The adductor squeeze, you'll need a football for this one. The idea is to just squeeze the ball in between the legs as hard as you can, generate lots of tension and just really feel what's going on around the trunk and the pelvis. The slump test is a neurological test for the nerves. So tuck the chin, tilt the trunk forward and just raise one leg. If you're getting a lot of shooting pain down the hamstring, it might indicate a tight glute. So just have a little roll around and see if you can fix that one. And again, do both sides. The straight leg raise is a kind of an easier version of the slump test because we're unloaded. Make sure you brace the trunk, look ahead and just squeeze, check the range and don't swing the leg. It has to be controlled. We're going to do both sides as well. If you've got someone who can view this with you as well, you might be able to tell what angles you're getting and if there's any difference. Knee to wall for the ankle. Ankles are massively important. Just start really close to the wall and try and push your knee every single time towards the wall. What's important is to try and keep that heel grounded, as I'll point there, and make sure that we're having our knees track over the middle of the foot. A normal compensation pattern is the knee caving in and then sliding over the big toe. That's just almost cheating in a way. So make sure it tracks nicely and be nice and measured as you do it. keeping the heel flat. Hope you've enjoyed that. There's some strategies you can put in place to see where you're at physically. Thanks.